This is Kendall Lonk, a 16-year-old who was involved in a rollover crash in the vehicle she was driving. During the hurried transfer into the emergency department, her feet were mostly uncovered. Inside the trauma bay, physicians and nurses immediately began a coordinated primary survey. Electrodes and monitoring equipment were attached while staff evaluated her airway, breathing, circulation, and neurological status. Kendall remained conscious and alert throughout the process, continuing to respond as the trauma team worked around her. As concern grew for possible internal injuries, she was moved through the department for advanced imaging. During transport to scanning areas, blankets shifted repeatedly while clinicians maintained access to monitoring equipment and prepared her for CT evaluation. At times, one foot, and later both feet, became visible again as staff repositioned sheets and equipment around her body. The scans revealed one of the most significant injuries from the crash, a lacerated spleen. Although potentially dangerous because of the risk of internal bleeding, the injury proved stable enough to heal without surgery. Kendall's feet appear to rest in a fairly natural, relaxed trauma patient posture. The intermittent exposure and recovering of her feet was most likely a byproduct of repeated trauma evaluations, repositioning, imaging preparation, and temperature management. Trauma patients are frequently moved multiple times in a short period. Ambulance stretcher to ER bed to scanner table, scanner back to stretcher, and coverings rarely stay perfectly positioned during those transitions. Based on her overall body proportion relative to the standard ambulance stretcher length and the amount of remaining space between her feet and the end frame of the cot, Kendall appears to be approximately 5 feet 5 inches to 5 feet 8 inches. Because her feet are partly plantar flexed and viewed from a low frontal angle, perspective distortion makes exact sizing difficult, but they do not appear unusually small or unusually large for her likely height range, so a reasonable estimate is 8.5 to 10.